Hi, my name is Devin Anderson, and my poster is a descriptive study of COVID-19 related stressors, self-care, and well-being among food service workers in Tennessee. So at the beginning of the pandemic, there was a focus on spreading down the spread of COVID-19 by minimizing unnecessary travel. The state of Tennessee only did one stay-at-home executive order, and that lasted from March 3rd until April, towards the end of April, and that was pretty much it. For people with computer-based jobs, they were able to go home and pretty much stay home after that. But people that were deemed essential, and especially food service employees, they had to continue to go into work throughout the pandemic. Food service workers are placed in the high risk category due to their occupational hazard. So an employee's occupation is considered high risk if they're required to encounter the public and or infected persons. So obviously food service workers are encountering people as part of their job. So these employees have increased vulnerability and require additional PPE to prevent the spread of the virus. Unfortunately, we did not even start a mask mandate order until July 3rd. So this means even after the shutdown, the workers in the food service industry were consistently exposed to individuals who were not wearing masks for the first 6 months of the pandemic. And even after that, when people are eating, they're able to remove their masks. And so that continues to expose the people in the food service industry, as well as vaccine rollouts. They were not included in the vast majority of the early rollout for the vaccines. So for people who were in the health field or deemed essential in that way, there was some meat packing mandates that allowed for some people in those industries to be able to get vaccinated. But for the vast majority of like servers and things of that nature, they did not have access until the vaccine until the end when the general population did. So people with jobs deemed essential, such as food service industry workers, were forced to go to work in environments without mask mandates and without the ability to socially distance or vaccinate for almost the entirety of the pandemic. So I wanted to conduct a study to see an online survey that kind of asks people who were in the food service industry, the effects that COVID-19 has had on their mental health. So 29 people were participated that were working in the state of Tennessee in the food industry during the COVID-19 pandemic. The official core of my survey was based off the Psychological General Well-Being Index survey, as well as the UCLA Loneliness Scale and questions from the CDC's health-related quality of life. So these questions were about depression, anxiety, stress, their general health and vitality, as well as specific COVID-19 related questions in regards to their job. The lower the score of the survey correlates to a higher risk for negative mental health related issues. So the results of the survey found that people experienced additional stress and anxiety because of working through the COVID-19 pandemic. For example, 80% said they were happy to be at work, and 68% said that they found satisfaction with their work life, but 40% were seriously considering quitting their jobs. The highest rated of all the work-related stressors surveyed was stress related to the lack of PPE. Participants who expressed higher levels of concern for PPE also had similar levels of emotional exhaustion at work. Of all the participants who stated that they felt emotionally exhausted daily when coming to work, also stated that they felt additional stresses due to PPE daily. And participants who experienced greater COVID-19 related fears also experienced the lower survey scores. So the results of the survey suggest that people experienced negative mental health effects due to working through the COVID-19 pandemic. Overall, I'm really proud of the survey, and I would like to continue on to get more data. I think one of the largest issues with the project is that it did not have enough time to get enough people surveyed. And so we do plan to continue this work and to be able to grow our pool to see if our survey results stay consistent with a larger population of people. Thank you so much for watching my video, and have a good day.